Hey folks, good to see you again. We are going to talk about the knee today. We had a question on a tracking disorder and what to do with that. And it brings to the forefront the fact that we see a lot of knees, and it's important to understand what's going on with knees. So first, we're going to identify, all right, what the knee is. So pretty much we look at this knee, it's a femur, it's a tibia, and there's a patella up in front. Largely, it's a floating hinge. So it hinges, but it also has the capability, because it's the middle joint, to kind of move back and forth a little bit. It's pretty simple, but unfortunately, since it's the middle joint, just like a middle child, it'll get beat up a little bit from time to time. What is it? Is it an internal issue? Is it an external issue? Is it misuse? Or is it actually the integrity of the joint itself? That's the big question when people come in. Is this a surgical type of a knee, or is this a conservatively managed type knee? With integrity issues, those are going to be people who got rolled up on in a sport, or were doing something, they felt a pop or a snap in the knee, and it's very, very painful and very unstable. Those are your ACL tears, your MCL tears, your big tears and meniscus that really need some surgical intervention to reproduce the stability and the integrity of that joint. Most of the time we don't see those individuals within the office. They're generally going immediately to the emergency room, then to an orthopedic surgeon to get that integrity restored. Most of the time we're seeing people with external injuries, which are misuse type things or poor use type things, overuse type things, that can easily be treated conservatively with changes to mechanics, realignment of the system, and just awareness of what to do and what not to do. Big areas that we can point out on our diagram here are going to be problems on the outside of the knee joint. IT band or iliotibial band syndrome. Inside part of the joint, pes insurine tendonitis. Pes is just a fancy name for an area where three muscles come together, and you can get some tendonitis or tendinosis there. Patellar issues on top of the patella, that'd be quad tendonitis. If it's the bottom part of the patella, that's more of your patellar tendonitis or Osgood-Schlatter syndrome. So we look at these and we have inside, outside, top, bottom, but then there's also behind the knee itself, which is a lot of CrossFitters will get. They're a little bit more knee dominant with their squat, and they're shearing through that knee and getting a lot of stress between the patella and the femur. It's called chondromalacia patella or patellofemoral pain syndrome. It doesn't really matter what it is, it's just the fact that the pain's right here. That gives us an idea of what's going on regarding the misuse. Now, the big questions are, how do we get rid of these? Well, like we said, with major internal injuries, it's restoring the integrity of the joint, which is a surgical intervention. For these external things, we just got to get better at what we're doing. And sometimes that's a hard pill to swallow, especially for individuals who pay attention, who've been working hard. They receive coaching well, yet they're still running into some problems with a knee pain syndrome getting in the way of their development as an athlete. So it begs the question of, well, doc, yeah, thanks. That's really revolutionary to move better so I feel better. Well, it's one of those things. You do get it, but are you doing what's necessary to actually get your results? So with the knee, a lot of times we'll see people fail because they want to get back into squatting. They want to get back into doing thrusters and their metcons and really loading up the barbell to see what they can get done, and they end up kind of re-emerging into that same issue. So Matt Chan, I believe it was, just like a lot of great CrossFitters, doesn't hide anything. He tells you exactly what he does, exactly how he trains. And for him, he was giving away a lot of secrets, I guess, at a seminar. And people are like, dude, what are you doing? Why are you giving away all your secrets? You're second in the world. You might be at first, and you're giving away your plan. His simple response was, nobody's going to do it. I'm safe. Nobody's going to work as hard as I do and pay attention to as much as I do. And really, we can take that concept and filter it into these misuse type things and say, you're probably even moving poorly, moving too much, or you're doing both, and you're not doing what's necessary to take care of that issue. Another way to say it is you're letting your mind get in the way. You're not humbling yourself enough to say, I can't squat heavy for the next 3-4 weeks. It doesn't mean you don't do anything. It means you take care of how you're moving. You set up your system so that you can adequately take volume because of your improvements in technique. Then you're going to listen to your system so that you don't dive into that misuse or overuse scenario again.